Hello and welcome. I am Heather Hall, a registered dietitian and certified LEAP therapist, and I specialize in helping you beat chronic disease and eat your way back to health. So this video is intended for my clients who are participating in the LEAP therapy program that addresses food sensitivities and inflammation and can be an important step towards healing from chronic disease. So if that's you, you're in the right place. This is the week one of the 4-week Jumpstart program that's going to get you prepped to go into that LEAP protocol once we get your results back. So let's get started. Week one's a big week. We call this our pantry, purge, and fluid fix week. And then we're also going to talk about physical activity and get your physical activity plan going if you don't already have one. First of all, let's talk about the pantry purge. It's kind of the biggest thing that we're going to do this week. Your pantry, your cupboards, your fridge, anywhere where you keep food in your house is going to get a makeover. Your participant guide, which you should have with you right now. If you don't, pause this video and go get it. You'll find a pantry cheat sheet in week one of that guide, so make sure you use that. It will be really helpful in kind of helping you to know what to keep and what to toss as you do this pantry purge, and it also is kind of helpful as a shopping guide as well. Let's talk about, like, what do I mean when I say real food? I am a real food proponent. You'll hear me talk about it a lot. I think that there's a lot of different healthy ways that you can eat. And I am not really a fan of following any particular, diet protocol, whether it be, paleo or Mediterranean. I think people get too stuck on names and this diet mentality we have in our country. And I just want you to know that there are a lot of different ways to eat out there that are going to be healthy and nourishing to your body. And so we're not going to get stuck on naming it any certain protocol. We're going to focus on making sure that it's real nourishing food that we're putting into our bodies. So real food means that it's minimally processed or unprocessed. It's going to have simple ingredients that you can recognize. You can look at that food and figure out where it came from and how it is made in most cases. It's going to have few additives and chemicals. If it comes in a package and has an ingredient list, there's not going to be a lot of ingredients there on that list. And when you read through that ingredient list, you can pronounce the ingredients and you know what they are. So those are some key guidelines when you're trying to decide if it's a real food or not. And now use your best judgment, because those guidelines don't always apply. For example, I like to use applesauce as a snack. And so I have applesauce in my pantry, and you can't find applesauce on the shelf that doesn't have ascorbic acid in it, which is basically vitamin C to help retain the color. And so, some additives like that, it's hard to get away from, and those are okay. But I do not buy my applesauce with any added sweeteners in it. So the only ingredients in there are going to be apples, water, and vitamin C. And that to me is a good real food ingredient. I can figure out how it's made. You cook and mash up the apples and you put them in a jar. So, and then just keep in mind that most real food, a lot of the real foods that you're eating don't require packaging and ingredient lists. For example, produce that you get isn't going to come packaged or have a list of ingredients with it. Fresh meat, that is going to come in a package, but there's no ingredients list with it. It's just meat, If it does have an ingredients list, try to look for something less than 5 ingredients. That's not always the case. For example, there's a Laura bar that I like to use as kind of a convenient food snack. It's almost like my treat. And there are some flavors. They're all real food ingredients, but some of those flavors have more than 5 ingredients. But I can read through that list. I can recognize all of those foods as whole, healthful foods, and so for me that still qualifies. So use common sense and good judgment as you go through this. Whole foods are going to be rich in vitamins, minerals, phytonutrients, antioxidants, fiber when it comes from a plant food. They're also going to be rich in flavor, and a lot of times they might even be rich in probiotics and enzymes if they're raw foods or fermented foods. Your body is incredible. It is so well designed, and it can function fairly well off of a fairly poor diet for a long time, but eventually it's going to catch up to you. And one of the ways it's able to function so well is this theory of nutrient triage, where, for instance, if you're not getting enough magnesium in your diet, which is a common deficiency in the standard American diet, your body is going to use the magnesium in the most important areas first. Magnesium has hundreds of important functions in the body. But one of its functions is to help your heart to regulate and keep pumping. And it also serves as an electrolyte to help keep your fluids in balance. And so those are two important functions of the body where if your heart's not pumping or your fluids and electrolytes get severely off, both of those are things that can cause immediate death. And so your body's going to use the magnesium in those areas where your short-term health is protected, but your long-term health may be in jeopardy as it shunts that magnesium from other systems in the body that also need it, but maybe aren't as important for your immediate survival. So don't make your body play nutrient triage anymore. We're going to make sure that we are just giving your body just an incredible amount of nutrient-rich, healthful, nourishing foods. All of the vitamins and minerals and phytochemicals and antioxidants that it needs to just thrive. Okay, another reason to eat real food is that real food sources are going to be naturally very low in sugar, and they're also going to be high in fiber and healthy proteins and fats. So we're going to talk a lot about blood sugar balance next week, but just know that managing your blood sugars is a really important part of controlling many chronic conditions. Probably we don't even understand the extent of it quite yet, but it is connected with a lot of health problems. So eating a diet that's low in sugar and high in fibers, healthy fats, and healthy proteins is really important for balancing blood sugars. Okay, next is real food reduces inflammation. And inflammation, as you will find as you go through all of the additional resources and bonus resources in your workbook, you're going to find that inflammation is a driver behind every chronic disease. So one of our major goals with the LEAP program and with the Jumpstart program is to reduce inflammation. And real food does that. Okay, real food's good for your skin. Who doesn't want to have healthier looking skin, right? It protects against sun damage, wrinkles, loss of skin elasticity as you age. It helps with clear up acne for a lot of people when they switch to a real food diet. It helps with rashes. Conditions like psoriasis, eczema, rosacea can all be improved by switching to a real food diet. And so this Jumpstart program, you'll get on this real food diet and you'll start to see some improvements most likely. And then when you get on your LEAP diet and we kind of customize this anti-inflammatory diet to you, that's going to be like a real food diet on steroids, because it is going to, just as the name, it's not what the name stands for, but it's kind of an accurate acronym. You're going to just be leaps and bounds ahead as far as reducing inflammation and letting your body heal. So, real food is going to lower your triglycerides, lower your cholesterol, lower your blood glucose if it's elevated, reduce your risk of heart disease, your cancer risk, and a whole lot more. And real food is good for your gut. And again, as you'll discover as you go through and explore those bonus resources that I've put in there, it is now recognized that many chronic diseases, maybe all of them, this research is really just growing and emerging here, but many chronic diseases begin with a breakdown of your gut health. And so reclaiming gut health and making sure that you have a strong gut lining, a vibrant and healthy microbiota, which is all those good and healthy bacteria and yeasts in your digestive tract, is going to be a super important part of this program and of healing from chronic disease. So eating real food is going to help you to prevent overeating, because real food is just going to be dense with fiber, which is very filling. It's going to, again, have healthy proteins and fats, which are also filling and slow down digestion. And it's going to promote dental health, which we all know that having to go to the dentist and get your teeth fixed is super expensive. But here's something really interesting. If you start your kids young on a real food diet that's low in sugar and a lot of those additives and processed foods, there is evidence that they will develop a healthier, wider jaw and straighter teeth as they grow. And you'll have to look in, if you're interested in that, look at the work of Weston A. Price. He was a dentist in, I believe, the 1950s or so, that traveled the world studying various cultures, and he studied the cultures when they were on their traditional diets, and as they had been switched over to a more modern, westernized diet. And it was just fascinating, the differences that he saw in their health and their jaw development and a lot of other factors. So check out his work if that interests you. Okay, eating real food is going to reduce your cravings. We talk a little bit in the program about something called nutrient hunger versus biological hunger. Sometimes you'll find as you switch to a real food diet that you just, after a while, you just don't have quite as much hunger as you used to. Some of that's because you're balancing your blood sugars, and that helps with hunger. But some of it, I believe, is because you are giving your body the nutrients that it needs. And I think sometimes when we're craving foods, your body is not necessarily needing the calories that those foods provide. It's needing more nutrients. And so you'll find that your cravings may be reduced as you switch to a whole foods diet. Okay, another really important reason for eating a real food diet is you're going to be setting an example for the people around you. If you have kids at home, it's going to be especially important that you're setting this example for them, and they may be resistant to making these changes along with you, but you're going to be setting that example nonetheless, and it will make an impact on them. And they might be just, happy as could be to follow in your footsteps too. So don't leave your family behind in this. Take them along with you as much as possible in your journey to better health. And then also, your friends and, extended family members as well, they are, going to see you improve, see your energy and your mood and whatever it is you're struggling with improve. And they're going to be asking you, what are you doing? What did you do to get feeling better? And so, and don't be afraid of those social situations where you're eating differently than the people around you, because you probably have no idea how many people around you are suffering with health conditions and looking for the answers and truly don't know where to find them. So, moving forward, let's talk about our fluid fix. So this is a pretty big step too for a lot of people, depending on what your habits are right now. The first habit that I want you to get in place during this next 4 weeks is a really important one, and that is that I need you to be drinking at least 64 ounces of water every day. And the reason for that is because going into the LEAP program, when you start drastically reducing your inflammation through the LEAP diet, some people retain water when they are inflamed, and so those people will lose a lot of water in the first couple weeks of their LEAP therapy plan, and they need to be drinking a lot of water in order to avoid becoming dehydrated and feeling lousy because they're dehydrated. Sometimes people will be feeling great, and then right about that 2-week mark, when they've really shed a lot of water and haven't been properly hydrating, they'll start to feel crummy again, and they aren't sure why. It's because they're dehydrated. So I need you to get into a habit of hydrating really well right now. Another reason is because as you are going through this Jumpstart program and your LEAP program and really nourishing yourself, your body may start flushing itself out. You may start flushing toxins and other things as your body gets into balance and kind of shifts things around. And you need to have plenty of fluids in order for your body to be able to kind of clean itself out. Another reason is, everybody's heard the statistic that your body is made up of 2/3 water. And that's true. And every cell in your body needs to have plenty of water in order to function optimally. So make sure that you are giving it good, clean water. Your digestive system is going to be going through some changes. You're going to be probably eating a lot more fiber than you're used to, and other whole real foods that can sometimes be more difficult to digest than the highly processed starchy foods that are typical in the standard American diet. And so lots of fluids are going to help to keep you regular and avoid some of those digestive discomforts that can come when you change your diet. And then most important of all, in my eyes, for drinking more water is because it is going to displace some of those less healthy drinks that might be taking up space in your diet that we want to get rid of. So let's talk for a second about other fluids that may be in your diet and the guidelines for this program. So throughout the course of your Jumpstart and LEAP therapy, I highly encourage you to follow the guideline of cutting out soda and other sweetened drinks from your diet. And we'll talk about this in a second. The other thing that I want you to cut out is alcohol, coffee, and any teas that are caffeinated. So let's talk for a minute about each of those and why that is. So soda and sweetened beverages. What's the problem there? 1 can of soda, again, has 40 grams of added sugar. And you can imagine then how much sugar the bigger soft drinks, the ones that come in the cups from the fountain drinks, how much sugar those have in them. And so the burden that puts on your body to be able to handle that influx of simple sugars, there's no digestion that needs to take place here, people. They just get absorbed pretty much straight into your bloodstream. Not only that, but we're drinking them in a convenient, easily consumable form, and so you're getting a big rush of sugar all at once, and your body just is not built to handle a sugar rush like that. It really taxes your system, and we're going to talk next week a lot more about the problem with that and how it contributes to a lot of the diseases and conditions that you might be suffering with. But for now, just know that it's bad news for your system. Let's talk for a second about diet sodas. So those are more healthy, right? Because they don't have sugar in them. Wrong. They're sweetened with something. They still taste sweet, so they have alternative sweeteners in them. They're not necessarily sugars. They may not be contributing calories, but they come with their own set of health risks. And they have not been shown in research to lower your risk of weight gain or diabetes or do anything good for you. Plus, look at that ingredient list and all of the gunk that you are taking in when you drink those sodas. So there really is just nothing that's good news about soda pop. One other problem is that you're drinking these super highly sweetened beverages, and some people drink a lot of them. And so it really dulls your sense of sweetness and your ability to really taste all of the different flavors in your food. And you require more and more and more sugar over time in order to get that sweet flavor and to be able to sense it. Now let's talk about alcohol and why I suggest that you go off of that during the program. In the book It Starts With Food by Dallas and Melissa Hartwig, they talk about some reasons for avoiding alcohol. So I'm going to share some of their reasoning. First of all, they say that alcohol has absolutely no redeeming health qualities. So forget what you've heard about it has flavonoids or whatever in it that are good for your heart. Just eat some grapes if you want to get some flavonoids in. You don't have to get it from alcohol. Alcohol is addictive. Alcohol inhibits your inhibitory mechanisms in your brain, which is not good for decision making and habit change like we are going to be doing over the next few months. It interferes with your glucose, your insulin, and your glucagon, and impairs, again, those blood sugars. It inhibits testosterone production, so that's probably not a desirable side effect. It promotes intestinal permeability or the leaky gut, which you'll be hearing more about throughout the program, and also the overgrowth of bad bacteria, which are both just basic ingredients for chronic disease. And then also it contributes to inflammation, oxidation, free radicals, and it decreases the antioxidants in your body, all contributors to chronic disease. Now let's talk about coffee. In an article on drhyman.com by Dr. Mark Hyman, he talks about 10 reasons to quit your coffee. I'll share just a few of those. So reason number 1 is that coffee actually increases your catecholamines or your stress hormones, which increases your cortisol, your insulin, and in turn your inflammation, making you feel lousy. Habitual caffeine consumption decreases, again, insulin sensitivity and increases those blood sugars and the risk of a lot of diseases like diabetes and heart disease. Unfiltered coffee has more antioxidants, it's true. It also has more diterpenes, hope I'm saying that right, which are chemicals linked to increased triglycerides, LDL, and VLDL, which are commonly referred to as your bad cholesterols. The acidity of coffee is linked with digestive discomfort, indigestion, heartburn, GERD, and dysbiosis, which just means you have more bad bacteria in your gut than good. And then also coffee may disrupt your serotonin balance. So serotonin is a really important hormone that helps with sleep, bowel function, mood, energy levels. And then coffee drinkers secrete more calcium, magnesium, and potassium in their urine, which are minerals and also electrolytes, which play a lot of really important roles in the body. And when we're facing a diet culture where we are under consuming those nutrients anyway, and then we're also being forced to urinate more of them out, that puts you in a pretty bad situation as far as micronutrient deficiencies go. And again, that's a big contributor to, you named it, chronic disease, which is why we're here. And then let's talk just a little bit more about caffeine. We mentioned it a little bit earlier, but 20% of the population has gastrointestinal reflux disease, or GERD, which is basically just chronic heartburn. And it can become a real discomfort and also a health risk for people. And I deal with a lot of people in the hospital and also in my private practice that have GERD. And so cutting out caffeine from your diet for a time is a really good trial to see if that is what is causing your GERD. I have had clients before that have been on heartburn medications for 10 or more years, and when they went off of caffeine for a couple of weeks, all of a sudden their GERD was cured. And that was all it took to get rid of years of unnecessary medications that were never meant to be on for 10 plus years. They've never been tested for that, and they come with a lot of health risks when taken for that long. And then also just that uncomfortable symptom. So another thing with caffeine is that it can increase digestive upset and diarrhea. And again, it increases the release of those stress hormones and causes inflammation. And again, it affects your sleep, your mood, your energy levels by affecting your dopamine levels. So just another reason why we're staying away from soda, coffee, sugary beverages, and caffeinated beverages for the course of this program. I encourage you to stay off of all of those things until you're at least through your first month of your LEAP therapy. And then if your MRT results allow for it and it doesn't show that you're reactive to those things, then you can try introducing some of those things back in if you want to. Some people find that after they stop consuming those things that they really don't miss them anyway, and they're not desirous to bring them back into their diet. But we'll see where you're at that point. Okay, so some options for better drinks to replace these ones. So of course, just water, lots and lots of water. But if you're the type of person that likes to have a little something else to drink too, here are some healthy options. So you can do kefir, which is almost like a drinkable yogurt. It's a probiotic dairy product that you can find usually near the dairy section in the grocery store. Look for it in little bottles. And then 100% fruit juice is okay in very small amounts per day. I usually recommend about 4 ounces a day for fruit juices, just because it is fairly stripped in nutrients and fairly high in sugar, even though it's from a natural source. I really like the fermented probiotic drinks that have become available in the grocery stores lately. You can also make them at home, but there's a water kefir, and you can find it commercially as Kavita. And then there's also commercial kombuchas that you can buy. I find both of these at my local grocery stores in the produce section, in the refrigerated section. And if I can find them in my small town here at both of our grocery stores, then you can probably find them in your area as well. They make sure you read the ingredient lists, but you'll see that they do have a little bit of sugar added to them usually, but that sugar is mostly processed out by the bacteria in the drink. The drinks are carbonated naturally by the healthy bacteria and yeast, turning that sugar into carbon dioxide. And that's what makes the drink fizzy like soda pop. So they're almost like a healthy soda pop replacement. So check those out, the Kavitas and kombuchas. I am not 100% sure about this product, but I've seen one also in the produce section called Mama Chia. And I've never bought it myself, but that might be one to read the ingredient label on. And there's new products coming out all of the time. So just look around, read ingredient lists, look for wholesome ingredients in there, preferably no added sugars, except for in those situations I just mentioned. It's going to be really small amounts, and it's going to be processed out by the healthy bacteria in those products. And if you choose maybe some of the like smoothies and stuff that are available commercially, just make sure it's all real food ingredients and that you're not drinking a huge amount of them quickly, because that again can just be a huge sugar rush and taxing to your system. Okay, now let's talk a little bit about the physical activity component of this program. So physical activity is a really important root cause, or lack of physical activity, behind chronic disease, and your body is just made to move. And when you are making sure that you're moving and exercising and being active regularly, it reduces inflammation, it increases your muscle mass, it promotes, of course, healthy weight, as we all know, but it also can improve arthritis. It can help your thinking, learning, and judgment skills stay sharp. It'll improve your sleep. It'll help you live longer. It will reduce your risk of heart disease, stroke, colon cancer, breast cancer, bone density, hip fracture when you get older, and depression. And these are all problems that really are just epidemic right now. So I just want to say, of course, you need to check with your primary care provider and make sure that you are okay to do whatever exercise program you choose. But that said, most people are safe taking up a physical activity program, and it is encouraged for most people to do so. I don't care what you choose to do. Just do something. And here's the really important part. Learn to love it. Learn to love being active and moving and what your body can do and the benefits that come from that. Don't do it because you want to lose weight or you want to burn calories. Those are the worst reasons to exercise because you will never enjoy it and it will not get you out and moving long term. It's an external motivator and it's a poor motivator. So learn to love exercise for the benefits and the movement and all of those things that go along with it, but don't do it to burn calories. So here's the recommendation. These recommendations come from the government, and I feel like they're pretty good recommendations. And so this is what we're going to go with in our program. They recommend 150 minutes of mild or moderate exercise a week. I know that sounds like a lot to some people. Or if you're doing more vigorous activity, something that's really getting your heart rate up and has you breathing pretty hard for the duration of the time, then about 75 minutes. So 150 of mild, moderate, or 75 of vigorous exercise per week. And make sure that you include in there 2 days of strength training. So what I personally like to do is I like to combine my aerobic and strength training into the same workout. So you can totally do that and count it. As long as you feel like it's meeting those guidelines for you, then you go ahead and count it. What I love to do is either free YouTube videos where they're doing, pretty vigorous aerobic or cardio type stuff combined with strength training at the same time, so that I, can do 3 25 or 30 minute workouts a week and I am meeting or exceeding those guidelines. You do what works for you. You choose something that's going to be enjoyable for you. Sign up for a race and start training for it. Belly dance, walk your dog, play basketball with your buddies a couple times a week, do yoga or the Beachbody videos like I mentioned, get a gym membership if that is something that would work well for you, pack a jump rope in your purse or your backpack so that you can take it out on your lunch break and jump rope for 10 minutes. Bike ride with the kids. Just make it fun and make it doable for you. And the other thing that I encourage you to do is, switch up your exercise plan often and also have a plan. So, there's a place in your workbook for you to sit down and decide what your exercise plan is for this week. So fill that out, have a plan. And then if something comes up, a friend calls you up and says, hey, do you want to come play basketball with us tomorrow night? Then you can change your exercise plan to include that instead of whatever workout you were planning to do instead. But have a plan in place and you can always adapt it if you need to. Okay, let's talk now about meal planning, because meal planning is a requirement of this program. And the reason why is because learning to meal plan and have a shopping list is a really important habit and tool for success long term, but especially during a phase when you are changing your habits and changing your foods. Let's just face it, food is really important. It's a really important part of our day. It's a really important of our happiness and well-being. I need you to feed yourself well throughout these changes. Please do not try to undereat or avoid eating. I am not a proponent of that. It's not a good plan for your health, not even for your weight loss. So feed yourself well. Have plenty of healthy foods to fall back on stocked in your kitchen. Pack emergency snacks in your bag or in your vehicle. Just make sure that you always have a backup plan wherever you go. Also, I want you to get out of your comfort zone throughout the course of this program. Try new recipes, try new foods, find different routines and snacks than maybe are your go-tos right now. You're going to love some of the new things you try. You're going to not so much love some of the new other things that you try. So sometimes I encourage my clients to get a binder and start your own recipe book with the recipes that you discover throughout this program. So whatever new recipe you're trying for the night, make it, have your family try it. If you love it, then add it to your family's new recipe book. If you don't like it, then just throw it in the garbage and cross it out on your meal plan so that you know that's not a good one for us. But you're going to discover a lot of foods that you really do like that you didn't know you could like before. So keep an open mind and just get out of your comfort zone. Another tip I have for your meal planning throughout the course of this, you can make your own meal plans each week, or you can use the ones that I provide for you. So it's totally up to you. I don't care which you choose, but I did provide some meal plans for you just in case that's a pain point for you. But keep your meals simple. They don't have to be fancy. They don't have to be casseroles or things with a lot of ingredients. Just make sure you're hitting the major food groups that you need to. We'll talk again more about that next week. And just, choose, for instance, a meat source and some vegetables that you want to include and a starch of some sort. And just decide then, how are you going to prepare them? Are you going to roast the meat and vegetables, or are you going to saute them or barbecue them and add a few different seasonings and flavorings to them, and you've got yourself a meal. And you can use that simple formula and mix it up 1,000 different ways with different meats or vegetables or whatever you choose to do. So just keep your food really simple. It doesn't have to be complicated, especially when you're trying to make changes. And often the simplest food is the tastiest and the least stressful as well. So that's all I have for you for week 1. Make sure you go into your workbooks and check out those additional resources that I have lined out for you there. The required ones are the ones that I feel like you really need to do in order to get all of the main points that I want you to get and understand this week. But then I also include a bunch of bonus resources for you to go through. And I try to include a lot of podcasts, which podcasts are just audio files of people talking about different topics. And they're fabulous because you can listen to them when you're folding laundry and when you're driving your car or washing the dishes or whatever it may be, where you can just listen and be on autopilot with whatever you're doing. And so I use a lot of podcasts, and I try to provide a lot of them for you to learn more, because I feel like that is something that you can fit in and that most people have time for. Whereas it might be a little bit harder to sit down and read an article or something like that. So good luck with week 1. Keep me updated. Use that workbook that I provided to track everything and keep yourself where you need to be. And I will look forward to seeing you in the next video.